Every morning, millions of men do the same thing. They brush their teeth. They rinse with mouthwash. They spit. They walk away feeling clean, disciplined, responsible. But what if that 30-second habit is quietly sabotaging one of the most important systems in your body? Not your teeth, not your gums. Your erections. No, this isn't clickbait. And no, this isn't about hygiene. This is about how antibacterial mouthwash is destroying men's erection and sex life. This is about nitric oxide, blood flow, hormones, and a biological system most men don't even know exists. By the end of this video, you'll understand exactly why certain mouthwashes can weaken erections, who's most at risk, and what to do instead, starting today. Before we begin, please remember, this video is meant to educate and empower, not diagnose nor prescribe. Always speak with your doctor or a licensed medical professional before taking any action based on the content you see here. Talk to your doctor before you do anything. Please. Now, let's get back to how mouthwash wrecks men's libido, erections, and sex drive. Weak erections are a blood flow problem. Let's get one thing straight. Erections are not about arousal alone. They're not about testosterone alone. They're not even about age. They are about blood flow. Specifically, the ability of blood vessels to relax, widen, and fill rapidly. And the master signal that makes that happen? Nitric oxide, NO. Nitric oxide is a gas your body produces that tells blood vessels, relax, open, let blood through. Without nitric oxide, blood vessels stay tight. Circulation is restricted. Erections are weaker, slower, or unreliable. This is why drugs like Viagra don't create erections. They enhance nitric oxide signaling. Now here's the part most men never hear. Your mouth plays a critical role in nitric oxide production. The oral nitric oxide pathway. Inside your mouth lives a special population of beneficial bacteria. These bacteria do something remarkable. They convert dietary nitrates from foods like beetroot, spinach, arugula into nitrites, which your body then converts into nitric oxide. This process is called the oral nitrate-nitrite NO pathway. And it matters a lot. Because as men age, nitric oxide production naturally declines. Blood vessels become less responsive. Erections become more fragile. So the body relies more heavily on this oral pathway to maintain healthy circulation. Now here's the problem. What mouthwash really does. Most commercial mouthwashes are designed to kill bacteria. Not bad bacteria, not harmful bacteria. All bacteria. Especially alcohol-based or antiseptic formulas. When you use these mouthwashes daily, you wipe out nitric oxide-producing oral bacteria. Interrupt the nitrite, NO pathway. Reduce systemic nitric oxide availability. This isn't speculation. Studies have shown that regular antiseptic mouthwash use can lower nitric oxide bioavailability, increase blood pressure, impair vascular function. If it raises blood pressure, what do you think it does to penile blood flow? Exactly. Why this hits men harder. Women produce more nitric oxide naturally. Younger men produce more nitric oxide naturally. But men over 30, especially 40, 50, and beyond, they're already fighting. Endothelial aging, reduced vascular elasticity, lower baseline NO production. So when you kill oral NO-producing bacteria, combine that with stress, poor sleep, or low activity, and add age-related decline, you don't need a disease to lose erection quality. You just need one bad daily habit. And mouthwash is often the invisible one. If you like what we do here, please like, comment, share, and subscribe to the channel. It means a lot to us and helps us to create new men's health and well-being content every week. Thank you for your company today and for your support. Now, back to our topic. But my dentist told me to use it. Dentists focus on cavities, plaque, gum disease. They are not trained to evaluate systemic vascular signaling. That doesn't make them wrong. It makes their lens narrow. Here's the truth. You don't need to sterilize your mouth to have good oral health. In fact, over-sterilization may harm the oral microbiome, increase cardiovascular risk, impair nitric oxide signaling, This is why many modern researchers now recommend avoiding daily antiseptic mouthwash, using it short-term only after dental procedures, or choosing non-antibacterial alcohol-free options. What about chlorhexidine and medical mouthwash? Prescription mouthwashes like chlorhexidine are powerful. They're meant for short-term infection control, surgical recovery, acute gum disease. They are not designed for daily, lifelong use. Chronic use has been linked to disrupted oral microbiome, reduced nitric oxide metabolites, increased vascular stiffness. If you're using these long-term without medical supervision, that's a red flag for your mouth and your erections. Quick pause. Before we continue, here's something worth knowing. If you've been feeling frustrated or even embarrassed about changes in bedroom performance, sensitivity, stamina, or desire, you're not alone. And it's not your fault. There's a 100% natural solution that's already helped thousands of men feel confident and energized again. No pills, no injections, no procedures, no surgery, no risky shortcuts. Just a simple, easy home remedy you can make at home, designed to support what researchers are now calling the manhood molecule, a key factor for arousal, blood flow, and lasting power. Find out more. There's a link in the description and in the pinned comment. Check it out. It could be the very thing you've been looking for. Right. Now let me explain what you can do instead of using mouthwash. What you should do instead. Let's be clear. This is not about stopping oral hygiene. It's about smart hygiene. Here's what actually supports erections and oral health. Brush and floss consistently. Mechanical cleaning matters more than chemical sterilization. Avoid daily antiseptic mouthwash, especially alcohol-based or kills 99.9% of bacteria formulas. If you use mouthwash, choose gentle, non-antibacterial options. Look for alcohol-free, microbiome-friendly formulations. Eat nitrate-rich foods. Beetroot, leafy greens, arugula, these support NO production. Give your mouth time. If you do use mouthwash, don't use it immediately after eating nitrate-rich foods. The bigger message. Most men miss. Erection problems don't start in the bedroom. They start in the bloodstream, the microbiome, the daily habits no one questions. Modern men are surrounded by health products that quietly work against male biology. Mouthwash is just one example, but it's a powerful one because it interferes with a system your body depends on more as you age. Final thoughts. If your erections feel weaker, less reliable, or slower than they used to be, before blaming testosterone, before blaming age, before blaming stress, look at the small daily habits quietly sabotaging blood flow. Because sometimes the thing you think is protecting your health is doing the opposite. If this video helped you see men's health differently, like, comment, and subscribe, because we talk about what actually matters to men without hype. And if you want to support nitric oxide, circulation, and male performance naturally, check the 100% natural home remedy thousands of men are using to boost stamina and passion in the bedroom. No pills, no surgery, no pumps. Learn more. The link is in the description and in the pinned comments. Now, watch this video for more revealing content on men's health and well-being.